Environment check. This is the dog's room. I'm washing my hands and providing privacy. Hi, Mr. Glaspie. How are you doing?
Doing well. How are you?
Good. Can you tell me your name and full date of birth, please?
Dwayne Glaspie, October 16th, 1987.
My name is Shelby. I'm a nurse, and I'm going to be doing a head-to-chest examination for you today. On a scale of 0 to 10, are you in any pain?
0.
Okay. Do you have any allergies?
No.
Do you know what day of the week it is?
Tuesday.
And you know why you're here today?
Head to chest exam.
All right, thank you. So we'll go ahead and get started. Just on the general appearance, patient is alert and oriented ×4 and is in no acute distress. The speech is clear. His facial expressions and mood are appropriate to the situation. So for skin, I'm just going to look at your skin here. Skin tone is even throughout. It is appropriate to race, warm and dry. There are no wounds, lesions, or incisions noted. On inspection of the nails, the capillary refill is 2 seconds. The nail beds are pink, slightly curved, and there is no clubbing. I'm going to look at your head. Just tell me if you have any tenderness.
No.
No tenderness. On palpation, there are no lesions or infestations noted. The patient's facial features are symmetrical, and there's no drooping. I'm going to look at your eyes now. So on inspection of the eyes, the conjunctiva is pink and moist. The sclera is white. There is no redness or discharge in the eyes. Now I'm just going to have you follow my pen light in and out. The pupils are 3 millimeters, round, equal, and reactive to light and accommodation. I'm going to look at the ears. On the ears, there is no discharge, swelling, or inflammation on either side. Based on conversation today, there's no hearing difficulty. I'm going to look at your nose. Can I have you look up for me? The nose is symmetric with no deformities or inflammation. Can I have you block each side of your nose for me? All right. Both nares are patent with no discharge. I'm going to have you open your mouth for me. The lips, mouth, and tongue are pink and moist throughout. So next I'm going to listen to your lungs. So normally this would be on bare skin. On inspection, there's no deformities, no barrel chest noted, no accessory muscle use or respiratory distress. So on anteriorly, there are 3 lobes on the right and 2 on the left. So I'm going to start the right upper. Just breathe normally. Left upper. Right middle. Left lower. And right lower. Lungs are clear bilaterally. I'm going to have you turn around. And on the back, we're listening in 6 different spots. We're going to start on the left upper, right upper, left lower, right lower, left lower one more time, and right lower. So the lungs are clear bilaterally. I'll have you turn back around. So next we will do the cardiac portion. So first I'm going to have you, so patient would be back at a 45-degree angle and have you turn your head to the left. There's no JVD noted. You can come back over. I'm going to check the carotid pulse, which is on each side of the trachea. I'm doing this very lightly and bilaterally on both sides. Pulse is 2+, the rate and rhythm is normal. Now I'm going to listen to your heart. This would normally be on bare skin. So I'm going to start with the diaphragm of the stethoscope, and I'm going to listen to the aortic valve. The aortic valve. The pulmonic valve. Herb's point. Tricuspid. And the mitral. S1 and S2 are present throughout. Now I'm going to listen with the bell of my stethoscope. On the aortic valve. Pulmonic. Herb's point. Tricuspid. And the mitral. There are no murmurs present. Now I'm going to check the radial pulse on each one of your wrists. The pulse is 86 with normal rate and rhythm bilaterally. And that will conclude our exam for today. Do you have any questions for me?
No.
And on a scale of 0 to 10, what is your pain level?
0.
All right, thank you for your time. I'm washing my hands.